Okay, so thanks very much for signing up to today's session. My name is Martin. I'm a community learning worker with Aberdeenshire Council. I work in Banff Macduff and I lead on a project called Community Works Banff Macduff. So today I'm just going to speak to you a little bit about the project, go over what we've done and how we've done it and what we've achieved so far, and moving forward what we're hoping to do. There's a couple of very, very small case studies that I've written into the presentation as slides, which I'll let folk read because you'll be spoken out by the time we're done. And towards the end, there'll also be a brief chance for discussion, which I'm really hoping people will take part in, just around what you feel helps in terms of community approaches to tackling inequalities and barriers and such like. If you've got any questions going through, if you just pop them in the chat bar in the bottom, I'll pick them up, or somebody can shout at me if I'm ignoring them. I'm gonna try sharing my screen and we'll start off with a PowerPoint, if that's okay. So you should now see can everyone see that? I'm gonna take silence for yes. I can't actually see the chat box.
Yeah, I can see it.
Super, thank you. So if there are, I can't do the chat box on full screen. So if somebody can shout out if there are kind of any pressing questions. If not, we'll leave them to the end. So as I said, my name's Martin. I'm a community learning worker with Aberdeenshire Council, and Community Works Banff Macduff is the project that I'm going to speak to you briefly about this evening. So it's a community development project. It's hosted by Community Learning and Development, the community development team. And the idea of the project is really to kind of look at improving living experience, working experience in the area. And it's got a really, really broad focus, which is what makes it so interesting. So it could be looking at access to services. It could be working with people to improve those services, self-help. We've been looking at childcare. What's unique about the project in a lot of ways is it's a community approach. So it's not about the project developing new services and new approaches and distributing those or putting those out. It's about getting people involved to do that. And the project is funded through tackling poverties and inequalities. So I won't kind of read verbatim off every slide, otherwise we'll put you to sleep. But the theory of change is there's already a huge amount of work going on around poverty and inequalities. It's by no means new, and this project is there's examples of these projects kind of all over the place. But really what we want to do is increase participation, because we want to give people who wouldn't ordinarily have a voice. We want to encourage people who would ordinarily be marginalised or excluded. We want to make sure that they are part of it. What we do recognise is it's not going to be a very, very quick fix. The project's a year in and we've still got a huge amount of work to do. People need to participate multiple times and feel secure and confident and build trust in those relationships. It's also not about working with very, very one or two individuals. It's about working with as many people as possible from as many different cohorts as possible, and really trying to include as many people as we can. We're recognizing as well, and we're coming up particularly now, because a lot of things are digital, that participation is new, particularly online presentation and participation. So ultimately the project, we really want people to become active leaders, to become local leaders and local community champions. So far the project's been focusing on generic community engagement, so getting out there and saying who we are, what we do and why. The key focus is tackling poverty and inequalities, predominantly looking at inequalities which is inclusive of poverty. Income maximisation, CPD, action research around childcare. We're doing some funding into many public work as well as service support and development. So the reason Banff Macduff were chosen is CLD were approached by TPI, and it was really a question of kind of, obviously they identified quite clearly that there were issues with inequalities in Banff Macduff. The project does only work across Banff Macduff. As you can see here, the national average for child poverty in Scotland is roughly 21.71%, and kind of Fraserburgh and then Banff and District sit kind of very, very close to that. As well as figures in terms of household income, this is taken from the Household Income Bulletin of 2018. Your average Aberdeenshire household income is 36,220. You're looking at a significant deficit there in Banff Macduff of 24,000, as you can see on screen. So we know that community engagement is key to the success of this project. It's not going to work if we're not engaging with members of the community. It needs to be absolutely community-led and community facilitated, but professionally supported. So we are there not to lead and dictate, but we're there to support the organic facilitation that comes as through building social capital. So that could be looking at who one neighbour knows, and building contacts there. It could be looking at who the food bank in Macduff's working with and building contacts there. It could be bridging food banks in Banff and Macduff. So because chances are there's going to be crossover. What's really important, and what we pride ourselves on in this project, is we engage with communities on their terms and in safe spaces. So we're not sitting expecting communities to come to us. We're going out and we're standing in parks. We're before COVID, would be trying to speak to parents outside schools, would be doing pop-ups in local cafes and libraries and such like. So they're willing to see that it's creating that safe space, and that's really important when communities quite often are expected to come to services. So we've decided that this service is one that needs to go to them. And we're engaging with existing community groups because there's so much social capital, they have so much knowledge of what goes on, and we're offering and seeking support. We recognise that this isn't something we can. It's not a one agency, one project approach. It can't be, and it's got to be bottom up. So we've got to work from where they are and get them, support them to where they want to be, as opposed to telling them where we think they should be. So excuse me, in terms of income maximisation, we've been spending quite a bit of time in the cost of the school day, and that's awareness raising of eligibility of free school meals, clothing grants and such like, as well as things like for those starting primary school, the Best Start grants, because the uptake in Aberdeenshire was really low of Best Start grants, and you're looking at around kind of 75% of eligible families in primary schools and around 50% of eligible families in the academy we're actually taking the free school meals. So the way we approach that is it wasn't a case of stigmatizing and saying, hey, we think you might be eligible for free school meals, come and have a chat. We told everyone about it. Anyone who would stop and speak to us. A lot of people ran in opposite directions. They thought we were maybe selling something, but we just told anybody who would listen. We engaged in the primary schools, and ultimately what that has kind of led to is a roughly 10% increase in free school meal uptake after our direct engagement. We've supported targeted appeals around benefits entitlements, particularly around Best Start grants. So kind of Best Start grants they're eligible for at various stages, but one of the ones that folk were missing out on was the one they're entitled to when they're just about to start primary one. And what we've done with this project, so it's not just coming from ourselves as community workers and those who work in the welfare teams and so on, we've recruited and we're working with parent ambassadors. So it instantly kind of takes away a level there when we're looking at kind of peer support based stuff. So I've just been kicked out of my screen. There we go. If you on screen, you should see a case study from Joanna. We have changed her name at her request. I'll give you a second just to read that to give you. So this particular case study, it was a really interesting one because we didn't ask for it. It was something that we spoke to this person very briefly at one of the pop-ups we were holding, and we were holding a further pop-up a few months later. And she approached us and she told us kind of what happened. She said that she'd been successful in applying, and it wasn't a service failure in any way, shape, or form. It was generally kind of if families are entitled to certain benefits, they're automatically entitled to other things, but that they weren't entitled to this specific benefit, but entitlement was still there. So they got their free school meals, which was a huge help, as well the clothing grant, and they were further signposted to sit in the device bureau. So we can engage with the community as much as we like, but kind of ultimately, ultimately there needs to be as wide knowledge as possible of the services, the benefits and such like that are out there. So we have worked with Principal Officer for Welfare in Aberdeenshire Council, we've worked with Social Security Scotland to look at seminars on welfare and benefit offerings to make sure that health visitors, Home Start, we had a couple of councillors come along. We've had advocacy workers, food bank workers, a whole host of people come along to these welfare and benefit offerings to find out a little bit more about who can apply for what, how you apply for it, the eligibility. And we've done that face to face, and we've also, due to COVID, we've taken that online quite recently. And an overall kind of evaluation, 80% of our practitioners who attended these were found new services they were unaware of prior to the events, and around 90% of practitioners identified opportunities they were aware of, and that was things like they weren't aware that services such as citizen advice offered certain guidance on certain things. So it was really just about encouraging the community approach, speaking to each other and building that knowledge and empowering people to kind of make decisions for themselves. Another piece of work we've been doing is it was identified through conversations with parents that childcare was an issue. And whilst we were not able to we're not looking to provide childcare or change the governance around childcare, we were wanting to try and identify what the local issues were. So to do that, we recruited and worked with a small group of parents and carers, which included grandparents and kinship carers, and they developed a survey and distributed across peer networks, put it out to their friends, put it out to schools through parent councils. We put it out to schools and playgroups and such like. And overall, we had 115 folk give us feedback on that survey around what the barriers were, be it cost, be it access, be it provision, availability, such like. So we've finished stage one of that, and what we're going to do now, stage two is going to look a little bit more in depth at what needs to happen and who needs to know about what needs to happen. And we've already recruited a second focus group of new parents with that, and the current focus group will be sort of like a steering group, and the findings will be fed back across kind of various departments within the council and stakeholders. But what's really important is that research is parent-led, because ultimately it's the parents who are the ones that have the voice here. And again, I'll give you just a second to read feedback from focus group participant. That particular participant is kind of they're one of our peer support parents. They're also heavily involved in the second focus group, as well as generally kind of being an advocate for the project. And that's what I was speaking about earlier. It's about kind of giving individual people kind of that voice and that power, and making sure that I suppose it's kind of building their trust and empowering them to ultimately mitigate and to feed back to communities what we're doing. We've also got a funding pot which closes tomorrow. Actually, the first round closes tomorrow, and this has been a really interesting piece of work, because it's not your usual funding pot where you've got to be a constituted group and have various governing documents and committees of X. Excuse me. So we've got £20,000 available to those working in Banff Macduff, focusing on children survive and thrive. So your early years, your mental health, your gender justice, which encompasses domestic violence, LGBTQ, and we've got safe places looking at homelessness or at risk of homelessness. It was a really simple application process. Again, we got some feedback from people who are working within those thematic areas, so companies and organizations working within those thematic areas. And what's going to be unique about this is two things. Excuse me. The decision-making panel, we're recruiting what's called a mini public, and Sorry about that. And that money public is going to be made up of a small demographic of each of the above criteria. So it'll be service users and service providers, and they're going to be the ones that make the decisions on who does and who doesn't get money. And that'll be facilitated by myself and a colleague. But people can apply for as little as £30 if they want to look at providing board games to combat social isolation, or they can apply for up to £3,000 if they need money for staff costs or resources. And we've got some terrific applications coming in. But the process isn't as stringent as a standard funding theme would be. So how it's going to work is we're going to be giving payment cards, and if the project works, then absolutely fantastic. If it doesn't work, it provides a learning opportunity. But what's really good is we're able to take almost a slight risk in this project, because it's all about empowerment. So we want to give power to the people who ordinarily wouldn't be able to access funding. So we have groups of a couple of people who want to do something around food poverty, for example. So there'll be more information about that kind of moving forward, but it's a really interesting piece of work, and it's quite unique in terms of operating a funding stream. So all of this kind of, it goes somewhere. So a lot of it's around service development and support. So it's working with groups on their governance, working with groups on their structure. It's networking. Networking is absolutely imperative to it. We're lucky enough to have built up a really strong network through a whole host of organisations, community groups, and individuals. We link with the strategic groups across the council. We link into the LLCP, almost a steering group, along with GIRFEC groups, community planning, and such like. But it's about strengthening partnership working. So as I said at the start, it's not about developing brand new services. It's not about saying, hey, we're great, we can do it. It's saying everything's great, how do we do it? Really kind of wanting to give local people a voice. And the project focus is understandably moving a lot at the moment towards the whole income maximisation, but access to food. And a really positive piece of work with that is food parcels in food banks in Banff Macduff really struggle to access anything other than dried foods, tinned food, that kind of thing. So we've partnered with local allotment holders, and they've been donating excess fruit and veg to food banks. We've partnered with Duncan Farms, and they've been donating eggs to food banks. So when people are getting food banks, they're getting the necessary staples, but they're also getting fresh fruit, fresh vegetables. We've had mums come back and mention that they made rhubarb crumble and they'd never ever seen or really understood what rhubarb was, and that's feedback like that's fantastic. And another wee case study just to give you a break from me speaking. So this chap recently, he didn't engage with anyone unless he absolutely had to. So he engaged where he had to look at sorting out his benefits, and if he was really struggling to access food, he would nip down to the local food bank. But he's now part of our focus group to look at the research around childcare. He's now wanting to be involved in doing some peer-to-peer work, so we can let people know that actually speaking out and accessing the array of services that are there makes a massive difference. So he's went from really not wanting to engage and almost kind of living hermit-like to building confidence, and he's going to be signing up to training through the foyer that they provide, and he's just a really keen advocate for people who have undergone situations similar to his. So really kind of what we've managed to achieve so far through this community approach is local communities are more aware of the project, the services that are available, and we've engaged around 400 people that kind of we engage with through kind of email, through telephone occasionally, but predominantly through social media. Communities are much more widely aware of support. We've had feedback from likes of Citizen Advice, we've had feedback from council, we've had feedback from food banks that more people are much more aware now, both professionally and personally, of services that exist. The project's generally more familiar to council staff, which is really important. Food banks and local providers are more aware of each other. So there's a stronger network now than there was before of organisations speaking to one another. We've also got national organisations such as Social Security Scotland, we've got Alliance and such like involved in the project, and we're moving obviously at the moment a lot online. So there's still that CPD to staff working with communities. And last slide. We're moving on with recruitment of community champions. We're looking at stage 2 of the act and research, and a lot of that I think is going to look at the impact of COVID from a familial perspective, so looking at kind of the families. We're also hoping to secure further funds to look at rolling out another stage of Shift to Power, the small funding. There's going to be vision exercises, so people across the board will get the chance to look at how services are, look at how communities work and such like, and really kind of how they want their communities to be. The income maximisation and CPD will continue. We're about to develop a signposting project, which is kind of just formalising the work we've done so far, really around a more formalised process for referring to other organisations, so organisation to organisation. And we're also going to be looking at living wage, employment conditions, and they go hand in hand. So making sure a lot of what came back in the childcare survey, for example, was maternal and paternal pay and such like wasn't where it could be. So we'll be looking at things like that and how best to engage with the communities, employers, and so on and so forth. So that's my presentation kind of done. I'm going to stop sharing just for a second, if that's okay, so I can see no one's escaped or fallen asleep. So I am hoping to, don't know how I've done that. I am hoping to open up to just a very brief conversation around what people here tonight think what's important to a communities-based approach in addressing inequalities, and what you feel the barriers are, just really to generate a bit of discussion. So I'm wondering if anyone has any thoughts or ideas. I'm looking for the mutes disappearing, but no one's taken it off. And if folk, a face has appeared, it's a good sign, Tanya.
I'm just thinking, Martin, if is anybody else wanting to say anything? Because if not, if I just jump in just for a couple of minutes and just say why I'm on this meeting.
That'd be great.
Yeah, okay. So it gives people a chance to have a think about what you've just said. I did work for Aberdeenshire Council as Community Planning Officer. I now work for the Co-op as Member Pioneer Coordinator for Murray, half of Highland and this corner of Aberdeenshire. So I have a member of staff covering Banff, Portsoy and Aberthe. As of last week, so this is pretty hot off the press, the Co-op has changed slightly its 3 priorities for this year. They actually fit in very well with what you've just said, okay? Our priorities now are access to food, mental well-being support, and education and employment for young people. There are 3, and they are all in response to COVID and what we've gone through. And this is what the Co-op are thinking the priorities are going forward. That access to food is very much along the lines of working with groups with allotments, growing food, food clubs, community larders. So it's exactly what you've just said there. So that is our priority. I don't know if any of you are members of the Co-op. The membership changed last week for the better. Instead of getting 1%, you're going to get 2%. But also the community was getting 1%. They're now going to get 2% of all sales of Co-op branded goods. 1% will continue to go to the local community for causes as it always has done. The other 1% is going into this access to food to fund projects for the, over the coming months. Well, hopefully it's months and not years, but they take this very, very seriously, and that's why they're putting their money towards this access to food. So I would like my worker to get in contact with yourself out of this meeting, and she's there to help. We have other things in the pipeline which will help you as well, which is a platform for local groups, agencies to promote themselves, and for volunteers to put themselves on, and it links them all together. So we're working with Ava on that in Aberdeenshire. But there's quite a lot going on, but it very much ties in with what you're doing over there.
I'll share my contact details at the end. I'll pop them up on screen.
Brilliant.
So that'd be terrific to make contact.
Thank you.
Anyone else got any thoughts or comments on kind of what they think the barriers might be moving forward, or any ideas, or kind of what they feel is important, or any questions? Glenn.
Yeah, hi. This is music to my ears. I mean, for those that don't know, I'm one of the local councillors, and I see that Ross Cassie, I represent Banff District, and Ross Cassie is for Macduff. So we've got the twin towns represented. I mean, this is absolutely fantastic stuff, everything that you've said, Martin. I sit on the community planning partnership and the board, and on Monday the priorities, if you like, in relation to poverty were broadened, so that child poverty was extended to embrace poverty in its wider remit from a community planning partnership perspective, but also and significantly health and well-being was added as an additional local outcome. And so, I mean, Macduff and Banff, you mentioned at the outset of your presentation the significance of all of this to the work that you're doing for Banff and Macduff. We had a recent strategic needs assessment, which is a massive piece of work, which indicated that in the whole of the Shire, Banff and Macduff has the highest rate of child poverty, and part of that was income inequality. So the work that you're doing is, along with other welfare agencies, but the work that you're doing in this project is so needed. And my question is that things are going to get worse with the end of furlough, and from, in terms of council tenants and the payments of rents and rent arrears, and I just wonder whether how the resources that you've got at the moment, whether it's going to be stretched to a degree where you'll really need much more to sort of bring about the outcomes. I'm really pleased to see the outcome focus that you've got here. That's really significant, because a lot of the time you can have a brilliant project, but in terms of targets and outcomes, I mean, you really seem to be focused on that. So I just think it's so needed. I just wanted to make that as a local councillor, that the work that you're doing is so desperately needed for so many people in Banff and Macduff. And I'm sure that Ross will say the same, but if there's any way that we can help, then just get in touch with us, because the community planning partnership is at one with everything that you're dealing with here, and recognizes it has had to tweak its own priorities, and it's all fitting in with the work that you're doing. So thanks very much.
Thank you.
I can just follow on and confirm what Glenn has said. We had a presentation yesterday at Full Council in relation to the impact in the community, and it is quite clear to see that it is the north of Aberdeenshire, particularly this aspect, this area of it, that has been hardest hit, and will potentially take a lot longer to get out. So the more help that is here, and the more working together in partnership, with the outcomes as being described, is going to a better place. I think we spoke before at the Macduff Development Partnership.
Yeah, absolutely. Yeah.
The work that I mentioned to you there in relation to working with the Living Wage Foundation as well, when you're talking about maximisation of income and getting that's going to be coming to the next thing. So I've said this now has to be a priority. So, but that's obviously a lot more longer term than the stopgaps that are here at the present.
And I think kind of picking up on both points, we are absolutely going to see an increase due to the end of furlough and redundancies and other bits and pieces. And we have already started work with the organisations about kind of checking their capacity. Because obviously we don't deliver kind of projects per se, we work with projects that deliver projects. So a huge part of that is making sure that projects are ready. So it's kind of appreciate that back and thank you. I noticed a question around Aber Necessities. Yes, we worked with Aber Necessities. Well, I say worked with. We connected a couple of local organisations with Aber Necessities at the start of COVID around kind of providing the resources they provide and giving them somewhere to store them. So it was much easier, kind of given the vast network that they cover. It was easier to have bases, if you like, where they can store certain resources that they distribute to families. So yes, we do. Any other comments, questions? No?
Hello. So we are involved in the Devonville Community Hub. What we've been finding, so kind of touching on how tough it's been for families, and we're providing clothing for children right up to the parents. And the overwhelming thing that we found is the parents are very quick to put the kids first, and they have a very basic need for clothes themselves. But there's only so much we can do with the clothing. So when you're talking about grants and things, there's very definitely a need for that. But also, I think probably one of the main barriers is people are embarrassed. People are very ashamed, and they don't want it common knowledge that they're maybe relying on food banks and like our clothing hub. So what we've encouraged them to do is to give us feedback on our page confidentially, so that encourages other families to come forward. So I think really the main barrier you've got is how you make it okay for these families to say, look, we actually need some help here, and it's not got the stigma that's attached to it just now.
I think one of the feedback that we're getting is one of the very few positives from COVID is it has provided I use the first word that comes as an excuse. That's not the right word, but they can say that the support's required because of circumstances related to COVID, which for a lot of families kind of probably isn't the case. So hopefully kind of that will kind of continue to break down. I'm aware kind of obviously through brief conversations with Kev and Gillian, the work that you do and the access that you've had. The hub's a huge, absolutely necessary. But hopefully, the stigma is a huge issue, for particularly in small places like Banff Macduff, because generally folk know who you are and they know that, for example, the River Church have the food bank and stuff. So there's a lot of work there, and hopefully through the peer support, the peer-to-peer stuff. So it's not coming from practitioners and things. Hopefully that'll also go a little bit of way, kind of as you say, through the feedback of your Facebook page and stuff. So, other forums you're finding it. That's kind of the big question. I mean, we found social media has helped, and this week as part of Challenge Poverty Week, we've started an initiative on our social media where services. So we've had Daniel's Place, we've had the library service, we've had Home Start. They send in videos and such, like, just of who they are, what they do, kind of 45-second just very, very brief clips, who they are, what they do, and how to access, or who can access. And we were already getting feedback kind of from one of the food banks that did it. They had 3 or 4 people just yesterday pop in because they saw the video and they weren't actually aware that the food bank existed. And we've also found, just through constant kind of email blast and bulletins to various partners in terms of kind of practitioners, we found that that's been really helpful. But I think that the key is consistency, though. So we've decided actually that although we started this video thing for Challenge Poverty Week, for example, we're going to keep it going, and we're going to use the videos every now and then. We're also I say a colleague of mine who's a little bit more tech savvy than I am. We're going to create not slideshows, but kind of like a constant video link of the services as well. There's also some really good work ongoing with Ava and Deborah Campbell, the community planning officer. They are looking at a kind of guide type thing of services that are available. So our Facebook is called Community Works Banff Macduff. And again, I'll pop that up at the end, along with my email and my colleague's email and phone number. So but Community Works Banff Macduff, if you search for us on Facebook. Any other questions or comments, folks?
No, I thought wanted to come in, just also picking up on what I think Emeritus said about the stigma. I work with people on a recovery journey from drugs and alcohol, and obviously there are close links between people affected by addiction and poverty, as well, as the statistics confirm for us. And we just had a discussion within that community this afternoon that Martin was there as well, and that was one of the issues that was raised there as well, the stigma around asking for help, the stigma around asking for food, and that some of the processes that we have in place to distribute things might add to barriers rather than alleviate them, like the referral system to that exists for quite a number of the food banks, not all of them, but sort of the main ones anyway, because it requires people to go through various steps and to disclose where they are at and what their need is to different people, which often puts them off. And I think that's something to be looked at, how we can sort of create more dignifying systems as well, such as community larders and things like that work in a different way. But I'm also I'm very glad that this project exists, and it has had, from what I could see over the last month, quite a huge impact in the Banff area as well. And certainly some of the folk that I'm working with have gotten involved and are hopefully also benefiting from that through the processes as well. So well done, good work.
Thanks, Dan. No, it is a big issue, and I think, I mean, Daniel's place, for example, they've set up it's not quite a community larder, but it provides that choice. You know, they've set it up like a shop, and you can go in and you can pick a little bit more of what you want. I was saying in the meeting today, we've had a couple of examples of almost, if you're hungry, you'll eat it, which instantly takes away that kind of hold. And it's not coming from a bad place. It's coming from a place of people who are genuinely they're trying to provide as many services as they can. But there's a long way to go there. I've got one question in the bar, and I can see We don't as yet have a forum with people for chronic health, but what we are kind of looking to develop is different forums moving forward, because we recognise a lot of the work is focused on children and families, and kind of poverty, it doesn't discriminate, so nor do inequality. So we are going to be looking at that. So if you're happy to, when I share my details, if you could pop me an email, and we can talk more about it. Hello. Susan.
Oh,
No, carry on.
okay. No, just quickly, just picking up on what Tanya just said there about the stigma and people not wanting to use food banks, obviously because of that. We're actually supporting. It's a type of food bank, but I can't what the actual name is, and it's down Montrose, Arbroath Way. But there's some obviously right across the UK. They're like food banks, but you pay £2 and can take 10 items. That is working. People feel much happier. That's the feedback we're getting. People feel much happier. They're not looking on that as charity. It's basically cheap food, and they're much happier to go in and do it that way. So that's something we're looking to promote.
Are you aware of those kind of, are they open to everybody, or are they? No, so
no, they still need referrals. We are getting issues with community larders, and we haven't got the answer to this one yet, which are open to everybody, and they're basically not manned. You can just go and help yourself and what have you, but people are literally helping themselves to everything and wiping them out every day. 1 or 2 people, they're just going and taking the lot. So we haven't got the answer to that one yet, but that is quite a common problem right across the country. But this, where they're paying a little bit and then they can choose what they want, is actually working really, really well, and it reduces that level of stigma.
Yeah, and it's a bit more empowering, isn't it? Because they're contributing in some way. So and there's always going to be that balance of kind of people who find loopholes or whatever, but generally, so I'd be interested to know more about it.
Yeah.
Any other questions or comments, folks? I'm going to share my screen again so I can share my contact details. In fact, I could put them in the chat bar, couldn't I? And that way folk have got them. So that's my email address and phone number, and our Facebook page is just Community Works Banff Macduff. So our Facebook page is really, I mean, I'm biased, but I've put that privately. Hold on just a second. So I'm not very good at this Zoom thing, I apologize. So that's our Facebook page. And that is my email. This is my email address and phone number.
Martin, it's Annette here. What
Hello.
we can do is we've got everybody's contact details because everybody's registered today. So folk, if they don't have a bit pen and paper to write down your contact details, we'll email it out to them first thing tomorrow so that they have all the links and your contact details and phone number, if that's okay.
Yeah,
just sometimes I know that in Teams you can see the chat afterwards. I'm not quite sure how Zoom, I'm not a Zoom expert, I'm not sure if it stays on people's computers, so we can do that because people will be asked to evaluate sessions, so we've got their contact details. Is that okay?
Yeah, and by all means.
And if we can have a copy of your slides, then we can always send that out too with everybody, with your contact details. And obviously this has been recorded and we'll upload it and put it on our YouTube playlist with everything else, which will be open on Sunday. But those that are there tonight can get the slides and contact details tomorrow. Okay.
Super, thank you. But by all means, folks, please do get in touch and give our Facebook page a like, because there's updates from a whole host of things. We put updates from the government around the whole COVID thing, about where to seek support around furlough. We've got the videos this week and next week, and as I say, they'll keep going. So please do ping me an email, share my email with colleagues, and get in touch via Facebook. And if you want to be added to our mailing list, it's just myself and my colleague Rasheen that email from that. So it's not a huge amount of emails bombarding you. So, are there any other questions or anything folk want to raise before we look to finish up? No. Okay. Well, Annette will pass on details and slides and things tomorrow. But meantime, thank you very much. Thank you very much. And it's getting late. Thank you very much, everyone, for your time. And I look forward to hearing from some of you. Hopefully, all of you in some way over the next little while.
Thank you very much, Martin.
Thanks, guys. Thanks, Agnes.
Thank you.
Thanks, now. Bye, everyone.
Bye.
Thank you, everyone. Thank you, Martin.
Thanks.
It was a good session, Martin. Thanks very much.
Thank you.
I'll be in touch tomorrow.
Perfect. Thanks, Annette. Speak to you soon.
Okay. Bye.
Bye.